Welcome, Yee Chang, to the Nyajamawaki TV show. Thank you so much for your time and coming on today to talk to us a little bit about the report that you worked on. This report is about perception and impact of COVID-19 and vaccination in the Hmong community, but specifically in the Minnesota community. So introduce yourself a little bit.
First, I just want to thank you to Dawn and to Yajong TV. It's great to be here. My name is Yee Chang, or Yee Chang, and I live in the Washington, D.C. area. And I'm the program manager for the Hmong Health Equity Initiative that we're starting with the 21 Collective, which is a national organization based here in the Washington, D.C. area.
And for your organization, what is the mission or purpose?
We started the organization in 2021. That's sort of the name, the 21 Collective. And we our mission of the organization is that we want to see a community that is safe, that is thriving, and that we believe that we can create this space with ordinary people in our community and to bridge our communities together, whether they're communities of color, Asian Americans, and other communities that have equity in all areas, including health, social justice, and just a collective of issues that have a lot of inequities between the services that are out there and what we have experienced as a community.
I know that you guys worked very hard on this survey and report. Please share with us a little bit about the significance of what you have found.
First, I'd like to just introduce the organization's program that I'm in charge of, which is called the Hmong American Health Equity Campaign. And we started to do this in 2021 in the middle of the pandemic and to address some of the issues that hold our community back from thriving. And so one of those issues, of course, was the COVID-19 that impacted our community at the beginning of 2020. And we're still in the middle of it. I mean, we don't know where we go from here, but one of our goal was to shine a light and a mirror about what had happened with the COVID, how it impacted our community, and how we perceive as a community, how we perceive the virus, and how we perceive the ways in which we can prevent ourselves from being infected with virus, and how we responded to it in general. And so we started this community survey last year. It took about 5 months for us to complete the survey, and now we have a full report that we'd like to share with the community.
Tell us what you found and how can everyone else across the country relate to this report?
Well, we targeted one of the most concentrated areas where Hmong Americans live in this country. And it just so happens to be in the Minneapolis-St. Paul area. And so the results of the survey in this report came from interviewing close to about 1,000 Hmong Americans of all ages, male and female, in the areas of Minneapolis and St. Paul. And what we found out in terms of the impact of COVID in our community is the perception of COVID-19 vaccination, for example. We found out that the vast majority of Hmong Americans believe that the COVID vaccine was safe, whereas very minor minorities said that it was unsafe. And so that's one thing that we may have heard about, but but we had no data to support any kind of positions. And now we have at least some data that are directly from the community to suggest that not only were people worried, the vast majority of Hmong Americans were worried about the crisis, and the vast majority believed that it was a significant crisis. Like I said, not only that, but they perceive the vaccines that later came as being safe. And so those are some of the general numbers out there. I'd like to give more details about the numbers and then go into what we recommend or what came out of this report. in the process of collecting the data, we did direct phone interviews with many members of the Hmong community. And also we did an online survey. And then we did a little bit of in-person interviews, given that there was a lot of restrictions in being in person. But we found out that, for example, the vast majority, like I said, of people in the household that we surveyed, 74% of the people we surveyed said that they wear their mask all the time, while 24% say that they wear the mask sometimes. Over 51% of the people we survey in our community said that they knew someone in their family, whether it's immediate or extended family, that have died from COVID-19. And so this is very significant. It points to the disproportionate impact of COVID in our community. And that does say something about what had happened in the last 2 years. And before we did this, there was a report that said that there was a disproportionate number of Hmong Americans who were infected with COVID-19, but we couldn't get any other kind of data to support that. And so that was really one of the impetus for doing this survey, is to find out exactly what happened. And now we have some numbers and some percentages to share about what had happened. And not only that, but we found out that, in terms of the information about COVID-19, there was a lot of skepticism in our community about who to trust in terms of information about COVID-19, and also just ways to prevent it. I know that there are some in our community who resorted to Hmong medicine or herbal medicine, and that didn't pan out in our survey as much. Even though many people did use home remedies, the vast majority of Hmong Americans that we surveyed did seek the vaccine and felt it was safe. And so we had 94% of the respondents said that they had received the vaccine. And of those that received the vaccine, almost half said that they received Pfizer, and about 32% said they received the Moderna, and about 13% said they got the J&J shots. So these are significant numbers that we can go by in terms of what impact it had in our community.
Tell us a little bit about some of the key lessons that you've learned from this report. Share with us a framework or principles that you used.
So one of the things that came out of this report, or as a premise in going to doing this survey, is that whenever our community is faced with a crisis like COVID-19, which changed everything as we know it, it changed everything from work to school to just basic, how do you go about your lives? And it completely turned everything upside down in the last 2 years. And so one of the things we wanted to do was to set up a framework in which a community like ours, the Hmong American community, but it could be any community, how a community can be ready or can be better prepared for a crisis. And what we came up with is that we needed to incorporate some basic principles in corresponding to a crisis, and therefore to improve the way that we respond to crisis, such as a health crisis like COVID-19. So we came up with 6 principles in this framework to address the kind of equity issues we have in our community. And the first principle is a principle called a change mandate. Whenever there's a demand for change from the community, we galvanize the community to make change, and that change will only result if we take action. So obviously COVID-19 demanded that we needed to do things differently in order to respond to that crisis. So there was a change mandate, not by us necessarily, but by the crisis itself. And it galvanized our community to try to figure out how to respond and how to prevent our community from being impacted. The second is resources spent. So in any kind of crisis, there will be resources that In this instance, we had the federal government responding with resources in trying to mitigate some of the issues of vaccine, of safety, of social distancing, of masks, PPE, but investing in resource delivery mechanisms are is a great way for our community to access. And if we have the resources, where is it being deployed, and how is it being deployed? Does it give access to the community, and does it result in higher protection for the community? And will there be a greater return on that investment if we do it right? So resources is sort of the second principle. And the third is that we need access points. We need access points that are easy for the community. This will ensure that besides language barrier, there's also cultural barrier that prevents a community from fully accessing PPE, fully accessing information about where to get vaccinated, how to be safe. And so easy access points is one of the key principles in this framework. The other one, the fourth one, is trusted messengers. We in the Hmong American community, we know that there are Hmong American doctors and nurses and people in the health industry who are already trained in their field. And we needed them to be the trusted messengers during this crisis. And they were there. They were there to provide the information that was needed for members of the community so that they could trust them in terms of the information about COVID and how to address it. Not only professionals in the health industry, but also community leaders and elected officials needed to be trusted messengers. And so it's critical to have trusted messengers in any community to deliver the message to the community about the crisis. And then fifth, we needed a particular type of messages. And these are tailored messages that needed to be in language most times and needed to be in context of that community so that they can get the kind of reliable and timely and culturally and language appropriate languages that they can rely on for how to deal with this crisis. And lastly, community members then will start to adopt behaviors and belief changes that will result in a kind of sustained engagement and taking action together as a community. And for the last 2 years, we've seen that happen where now, for example, I automatically wear a mask because we've been trained in the habit of protecting ourselves. Or I constantly wash my hands now after an activity because of the belief that it's probably much better to be safe than sorry. And so we've, as a community, have learned some new lessons, and we have now some new habits to keep us safe from the next pandemic, for example. And so these are the takeaways from our project. We have some new data that we already put together, but we also are now providing a way for us as a community to respond better to other issues that may that we have endured or may still impact us in the future. There are many other issues that we also need to take a look at. There is just a lack of disaggregated data. There's a lack of data in general about our community. And so we as an organization have a goal to find out what those numbers are, find out what those data points are, and share them with our community leaders, share them with stakeholders, share them with organizations that work with the Hmong community, share them with our policymakers and decision makers at different levels of government so that they can better respond to the needs of our community.
Well, yeah, thank you so much for your hard work and the 21 Collective organization for heading this and putting in the time and energy to gather the data so that hopefully we can close that gap, that healthcare disparity gap within our community. Now, if people want to get more information or details or a copy of this report, where can they go to get that?
We have a website, and we have also Facebook and other social media platforms that we're on. But if you go to our website, www.the21collective.org, you will see the 2 reports that we have you can download. You'll also get, there's also information about what we do as an organization. And so I urge you to share the link to all your friends and family and community members wherever you live. I believe that this is the first of its kind of report about our community, and it sheds light on what happened in the last 2 years, specifically on the Hmong American community of Minnesota and the full impact of COVID and the perceptions that we have of COVID in the last 2 years.
Well, yeah, thank you so very much. Sounds like you guys have more work to do yet as far as helping out the community, and we wish you the very best. I'd like to also see if you have any last words for the community before I let you go.
I'll just say a few words in Hmong if I can. Cú sa hà đó cho là cho sĩ cho xin cho dễ cho cái tin trang xuất là ta bây cú giấy lúc công vụ cứ chỉ tao lu thà cho cái ban là tới dạng tới mình luôn luôn xử lý cứ COVID có cho bây cú chỉ giấy cho cái lúc khu mắc không nghe rồi trang tới mà bây giờ cho cứ chớp phá tới dạng cứ chuyển chính cứ mà mua cái tuần vô để bây cứ mua cho information là cho nó khá tật rồi tới nó tới chữ khá tật cho là chỉ cái tin trang xuất ra cho nó cho có sự là họ sĩ bây giờ information là sĩ bây giờ data cứ bên trả tao nó cho nó bán cho của bây giờ tao tới dạng tới mình cứ lúc cho được bây giờ tới này chỉ khó nói khó lựa chọn chính hay của sáng của mấy họ mong cho hữu biết họ website mấy họ mong mua cho bây giờ report nó share ha mua share cho bây giờ thành giờ gì cả của họ bao ha chỉ là họ là mua khá là tới nó tới chữ của nó bao ha là tạo từ bây giờ chúng mong bây giờ làm bá sư bây mua tàu họ chính là bây mua tàu tới number là tới percent cho bố sản phẩm mình là về mua cái tuần rồi là chả. And just lastly, thank you to Yee Chang TV and Tendon for this opportunity to share this information with our community. Thank you.
Thank you, Nyayi, for your time, and thank you so much for your dedication to helping to uplift and move all communities forward. So thanks again for your time.